everyone. Welcome to Well Within Reach. And today we have Ms. Erin Ormsby here, and she is a registered dietitian nutritionist at Thomas Jefferson University at the Division of Endocrinology, Diabetes, and Metabolic Diseases. So we are so excited. We're continuing our nutrition conversation. And so, Erin, we just want to ask you, tell us a little bit about what you do, because everybody wants to know, what does a dietitian do?
I love that question. And thank you, Neva, for having me. I'm really excited to just talk all things diabetes today. So that's really what I do at the Division of Endocrinology here at Jefferson. I see patients outpatient. So they either get their diagnosis of diabetes and then come to us, or they are following us for other reasons and end up, developing diabetes over time. So when that happens and when they get that diagnosis, they're able to come over to us. It's me and my colleague, Cheryl Marco, and we both see patients with diabetes and also pre-diabetes.
Well, we all know Cheryl Marco at Jefferson. She has helped countless patients over the years, and she's helped us with the work that we do here at Frazier. So we're glad to continue with the work that you're doing. So, Erin, I want to ask you a question. I'm somebody who just found out that I have diabetes. What can I eat?
This is a question that I get all the time, and patients will come in and tell me, please just tell me what to eat. And I often just kind of sit back for a second, and I like to explain a little bit about their disease and what's going on inside their body. And when we get diagnosed with type 2 diabetes, it really is where our body doesn't use insulin effectively. And when that happens, it's called insulin resistance, or we just don't make enough insulin to help our blood sugar stay at a healthy range. So, and that when we get that diagnosis, it seems really scary. And there's a lot of medical jargon and a lot of medical terms thrown at you. But there's so many factors that go into that diagnosis of diabetes. And understanding that, this is not your fault. This is not something that you created, but it's just the way your body is not working as effectively as we want it to keep our blood sugar balanced. So that's kind of where I start there. And then I like to move into understanding the fact of not cutting things out of our diet. Because the number one thing that you hear when you get diabetes is you can't eat anything anymore, right? That's what they all say. There's nothing that I can eat anymore. And I like to reframe that a little bit and really focus on what we can add in to our diet. I really love the aspect of not cutting out all carbohydrates. So carbohydrates are the food group that impact our blood sugar the most. So a lot of times when we first get that diagnosis, the first initial thought is, okay, well, let's just not eat carbohydrates anymore. But carbohydrates are the number one fuel source for our cells. So we want to eat them, but we want to eat them effectively. And my first part to this is really honing in on our proteins, our lean proteins specifically, and our vegetables. And then once we have that foundation, so for example, I wrote a little list here for myself because I think when people hear protein, they don't really know what that looks like. What is protein? Protein, we're looking at lean protein, so chicken, turkey, fish like salmon or tuna, eggs, Greek yogurt, cottage cheese, tofu, tempeh, or lean cuts of beef or pork. So we really want to focus on that food group to keep our blood sugar stable. And then we want to get in those non-starchy vegetables. So our greens, our spinach, our kale, our arugula, cauliflower, green beans, all that good stuff. And then we add in our carbohydrates. And what are carbohydrates? Because that's a big question that a lot of people ask. And carbohydrates are the things that we think of: pasta, rice, cookies, cakes, all that stuff. But it's also fruit juices, are some vegetables like potatoes and peas and corn. So knowing that, we want to incorporate the carbohydrates that maybe are not as processed. So things like our whole wheat bread and our brown rice and sweet potatoes, that kind of thing, but in portion, and definitely thinking about it that way as well. So that's kind of, I know that was a lot, but that's where I like to start off with patients. And to make it even simpler and a little bit more easy to visualize, I like the plate. I like the plate method. I like half of our plate with vegetables and non-starchy, really filling ourselves up. And then 1/4 of our protein. And then the other 1/4 are carbohydrates. And that's kind of how I like to start things off.
All right. Well, that sounds good to me. So when so I'm just finding out I have diabetes and I like the things that you said. So is when should I see a dietitian? Like should I make an appointment right away or when should I see a dietitian?
Yeah, I also love that question because I think people feel so overwhelmed when they get this diagnosis, and they feel like their first thought is going to Dr. Google. And I would refrain anyone from doing that. Now, not saying that the internet is not a helpful tool. I love the internet. We all use it, right? But being mindful that going in there can really be overwhelming. So having those resources and if you're able to, getting in with a dietitian pretty soon after that diagnosis can really help outcomes later on. You don't
Mhm.
feel as overwhelmed. You don't feel like you're just getting all of this information and you don't know what to do with it. Having that tailored, specific dietitian education can really help with that overwhelm and that first initial diagnosis.
Okay. I like the sound of that. So how about the person who's had diabetes for some years and they've been doing pretty well with managing their diabetes. Their blood sugars have been stable. And then, kind of life starts to get in the way and things start to shift and move. And now you're in a situation where it seems like, the scale is stuck and you're kind of tired of eating chicken. And what do I do now? I need to, hit the restart button on my dietary selections, but I'm kind of like stuck.
Yeah. And this happens so often. People come in and they get that diagnosis years and years ago, and they come in, I've been doing the same thing and it worked for me for a while, and now it's not working anymore. And the great thing about, well, one, I would say reach out to your endocrinologist, your physician, your diabetes educator, and say, this has been really hard for me, and I'm really struggling. What do you suggest that I do? And not kind of sitting in that and feeling like it's your fault for getting in this situation and all that stuff. Asking for help is definitely step one, and then what I would say is there is so much advancement in technology right now. I would definitely look into and explore the idea of what we call a continuous glucose monitoring system. It's a CGM, and some are covered by insurance. That's something that you really want to talk to your healthcare provider about, and also doing this in conjunction with a healthcare provider for assistance, with that whole process. But what they're able to do is show your blood sugar in real time, and you're able to see how foods directly impact your blood sugar. And with that advancement, it's not just that day old saying of, limit your carbohydrates and eat your protein, but really honing in on your individualized needs and what specific foods impact your blood sugar specifically, because it's so different for everyone. So exploring that can be a whole wealth of knowledge, and expanding maybe that initial really restrictive diet that feels hard and doesn't it's not sustainable.
That is that is such good information. Oh wow, thank you so much for that.
Yeah.
So final words. Give us your final words for today, because we're definitely going to bring you back, because this
I
is
love
just,
that.
I mean, you've given us so much information packed in such a short amount of time. I got to ask you to come back and continue this conversation. But for now, give me some final words.
My final words, and first off, I would love to come back, so definitely looking forward to it, because I feel like there's so much information. But I think my final words would be just take that step, and take that first step, and it may be scary and it may be hard, but doing something to benefit yourself. And this diagnosis is overwhelming, and diabetes sounds scary, but it doesn't need to be when we have that education and we're able to learn. So I think taking that initial step is the first part in all this.
Well, thank you so much for all of your information and just your words of encouragement. I feel like, people are going to be encouraged by this. And of course, they're going to want to know more. So thank you for being with us today. And we'll see you next time.
Yeah, thank you so much for having me. I will see you soon.